Welcome again everybody to a new video where we're going to discuss some of the mistakes that are encountered with the angle bisecting technique. And in this video graph you will see a common error that is often done when incorrect positioning of the cone in a vertical direction, what we call the vertical angulation, is incorrect. Elongated images of the teeth usually is seen when you direct the beam perpendicular on the object, or when the vertical angulation is reduced. So reduction in the vertical angulation, whether in the upper teeth or in the lower teeth, leads to elongated images of the teeth. In this radiograph of the lower central incisors and the canine, see how long the canine is appearing. Here the same problem has been encountered, is that when the beam is directed perpendicular on the sensor, not on the on the bisector. In other words, reduction in the vertical angulation. Reduction in the vertical angulation. So, a reduced vertical angulation will definitely lead to elongation of the images. Have a look on this radiograph. See how long the teeth appear. Now sometimes in cases of reduced vertical angulation, that is when the beam, as we said, is directed perpendicular on the object, not on the bisector, the image of the tooth is so elongated that you cut the image, you end up with cutting of the image of the roots of the teeth, even though that you have placed your sensor 2 millimeters, as you can see here below the incisal margin of the teeth, but the image is so elongated that the film length does not capture the image, so you end up with the cutoff in the apex of the tooth. Now the other thing that happens, although it's less likely than the reduced vertical angulation, is the increased vertical angulation, which is the opposite. Increased in the vertical angulation, that is when the beam or the X-ray cone is directed more perpendicular on the film rather than on the bisector of the angle bisector. So what we call as the increased vertical angulation. Increased vertical angulation would lead to opposite of the decreased vertical angulation, and you end up with short or foreshortened images of the structures. Now this is central incisors. Here the images will appear shorter, plus you will see the image of the nasal cavity, because the X-ray is coming from the top, so it passes through the nasal cavity and then it will cast its shadow. See, most of the premaxilla is appearing here, though the teeth are fully appearing in their length from the crown up to the root, but again you will see most of the premaxilla that is appearing because the X-ray has come through the premaxilla. However, foreshortened images or short images are better than the elongated images. Both of them are incorrect, of course, but if you want to see the whole tooth, increase in the vertical angulation. Okay, increasing the vertical angulation definitely will include the whole tooth, the whole length of the tooth, unlike the increase unlike the decrease in the vertical angulation, it will lead to elongated images and then the disappearance of the apex of the teeth, as we have seen in the previous radiographs. Okay, so what do you expect the cause here? It is an elongated image. See the crowns, this is the crown of the tooth, and the tooth appears longer than its real dimension. Now here you can see, just if you go back to the previous radiograph, you don't see the nasal cavity, because here we have a reduced vertical angulation. The beam is directed more perpendicular to the object rather than the angle bisector, and this has led to the appearance of the elongated image of the teeth.